Even though we are in the middle of a sweltering Houston summer, did you know we can actually all still be at risk for vitamin D deficiency?
Yeah, who'd have thunk? So what can you do about it? Joining us this morning is Dr. Archna Vajpayee, a primary care physician at Memorial Hermann Medical Group, West University. Good morning.
Good morning. Thank you for having me.
All right, so let's start with this. What are the signs of vitamin D deficiency, even with all the sun we're getting?
Okay, vitamin D is our sunshine vitamin that's very important for skeletal health. Mild to moderate symptom, if you have a mild to moderate deficiency, you actually will probably be asymptomatic. It's when we've had that prolonged severe vitamin D deficiency that we can get bone pain, bone tenderness, muscle weakness, fractures, and even difficulty walking.
So what would you say is so important about getting it naturally from the sun? Because most of us put on sunscreen that's blocking the harmful rays, but it's also blocking the vitamin D from getting into our body. How do we find that balancing act?
So you do want to continue wearing sunscreen because we want to protect ourselves from skin cancer. Keep in mind, even with a high SPF sunscreen, you're still going to get some absorption, so that will help. But supplementing through vitamin and diet will be helpful.
Is anyone more likely to be susceptible to vitamin D deficiency?
Yes, there's definitely a segment of the population that is higher risk for deficiency. Those are the people over 65, people who may be obese and have osteoporosis, people who are hospitalized or institutionalized, for somebody, who lives in a nursing home, for instance. And then people who suffer from malabsorption disorders such as inflammatory bowel disease or celiac disease.
All right, now you mentioned earlier that you can supplement, so let's talk about that. What are the best ways to do that? Do you suggest we try to do it by boosting types of foods that have that in it? What would that be? Or is it really important to take a look at those levels and then take a supplement?
Both things, actually. A visit with your primary care doctor would be helpful. Food sources you can get in fatty fishes, so things like salmon, tuna. Of course, in the U.S., our milk is fortified, and that's actually the biggest source of vitamin D through the diet. You get about 100 units per 8-ounce cup. Other dairy products have it, but to a lesser degree, things like eggs and yogurt. So diet, and then of course supplementation. You could start with an over-the-counter vitamin D, anywhere from 600 to 800 units if you are an adult who gets, average sun exposure through the year.
All right, thank you so much for filling us in. That's a lot of questions.
Very helpful. Good to see you.
Thank you.
Time for Memorial Hermann.